In this film, we provide the key facts about lung cancer, and you'll also hear people with lung cancer speak about the impact of their diagnosis. Lung cancer is the fourth most common cancer in both men and women in Australia, accounting for almost 9% of all new cancers. Around 10,000 people are diagnosed with lung cancer each year. That's about 28 people diagnosed each day in Australia, and it's about twice as common in men as it is in women. Lung cancer is the most common cause of death from cancer in Australia, in both men and women. In fact, about 1 in 5 cancer deaths are due to lung cancer.
The symptoms that presented with my illness, I felt a night cough. I felt a feeling of just unwell. Also some lethargy and some weight loss. And of course I was having blood sputum, coughing up blood. I guess I also was a little breathless too, a little short of breath, feeling, just not right, just not feeling well.
The symptoms when I was first diagnosed were very, very vague, a little bit of uncomfortable with swallowing. But apart from that, I was very well at the time.
I went to the GP, I knew something wasn't right, and I was given a stand-up x-ray. I kept seeing the symptoms the following day. I went to another doctor for a second opinion, and he scheduled a CT. And that's when it became evident.
There was a tumour that showed up in the lung. Obviously we didn't know whether it was benign or malignant. From there we moved rather quickly. He ordered a CT scan.
Well, lung cancer is difficult to diagnose because the symptoms often are quite vague and can in fact mimic other things such as chest infection or indeed heart disease. So that can sometimes confound the diagnosis and cause a delay in the investigation of lung cancer. The symptoms of lung cancer can include, for instance, hemoptysis or coughing up blood. But it can also mean that there are persistent or ongoing symptoms such as a new or changing cough, shortness of breath, unresolved chest infection, chest pain or indeed shoulder pain, hoarseness of voice, or indeed loss of weight. So if anyone has any of these sort of symptoms, particularly if they're lasting towards 2 to 3 weeks, they should really go and see their GP. Whilst smoking is definitely the largest single cause of lung cancer, you can certainly get lung cancer without ever having been a smoker.
If you have symptoms, it's important not to ignore them and to see your GP. Cancer Australia has developed a guide to assist general practitioners in the assessment of people who present with symptoms that may be lung cancer, and the timely referral to the expert team who can provide the appropriate treatment and support.
I said in the room of the oncologist with my wife present, I don't know where this came from, but I said, what if I don't do anything? And that is what we're up against with this illness. I thought it was pointless.
Some people may also feel that having treatment will be of little benefit. However, earlier stage at diagnosis of lung cancer is associated with improved survival, and new and constantly evolving treatments are likely to continue to improve lung cancer outcomes.
I'm living with this cancer and I feel very well at the moment thanks to this wonderful drug that I'm taking. I'm very mindful of the fact that this drug may not work continuously forever. But I feel that I can make my own contribution by remaining positive, having a good attitude, getting on with life.
It would be 4.5 years since I had my surgery, and I've got to tell you guys, anyone that's faced with a lung cancer diagnosis, don't throw any towels in, fight. I saw my child turn 13 last week, and I'm still here, and life is just beautiful.